Hello everyone, welcome to Bond and Boundaries Open Talk, and today I'm so excited. We are driving to Dr. Prajot Parmar's clinic, who's an homeopath. We're going to have a talk on healing on homeopathy. Let me to first talk about him, that who is he as a person and as in healthcare, how is he serving us, and how did he get there? Okay, firstly, he is an MD in homeopathic pediatrics. He is a gold medalist. He's done his oncology training from Switzerland, Tata Institute of Social Science. He's an homeopathic consultant at Cherish Healthcare Clinic, Mumbai Central, and also at Radiance Pharmacy, Marine Lines. He's an assistant professor in Department of Anatomy at Virar Homeopathic Medical College and an assistant medical officer, E-Ward, BMC Baikala. It's a privilege to interview him, so stay tuned and I'll catch you there once I reach his clinic, so stay tuned. Hello everyone, today I've come to Dr. Prajot's clinic and I'm so excited. Welcome to Bond and Boundaries Open Talk.
Thank you so much, and I also welcome you to my Cherish Homeopathic Clinic.
Wow, it's a pleasure. I'm so excited. There are so many questions I've got from people who want to ask you about homeopathy, so we're going to discuss that today. So Dr. Prajot, my first question is, in this modern world, since we all want everything very quick and fast, I know that homeopathy is a very slow medicine. That's what I've always known, and it's a myth. So I want to ask you this question, that how is homeopathy now impacting in the world? And people think it's slow, right? So then what do you have to say for that?
It's probably a misconception that we are having. Many of the myths are like homeopathy is slow, homeopathy is a placebo, and many of the things are going around. Somebody says that homeopathy has steroids and everything, but it is not true. Because homeopathy, if you have a patient with fever, if you have a patient with diarrhea, if you have a patient with a very acute complaint, okay, so based on the current symptoms, we can give a homeopathic medicine which will match the particular symptom, and that acts on the person, and then you get a good result out of it. So we also have a results in the acutes as well, not only in the chronic one but also in the acute one. Alright, so it's a proper misconception that it is not, it is very slow acting or something like that. हाँ, if you have a chronic disease, कि हाँ मेरे को मान लो कि मैं 15 साल से मैंने chronic disease लिया है and I have psoriasis and you go and tell me अरे डॉक्टर 2 दिन में मेरे को गायब कर दो, which is not going to happen obviously, because it is a very deep-seated medicine, deep-seated disease. And तो उसके लिए it takes time.
But many people I have seen that what they do, they first go to an allopathic person, allopathic doctor, they first trial and error, and then the last is homeopathy. That अगर कुछ नहीं चल रहा है तो चलो homeopathy. Then they say क्योंकि homeopathy में side effects नहीं है. Now this is something which I've heard so often from people as well, and I think that is a very challenging thing for an homeopathy doctor to solve a case which is already not being solved by other doctors. So I think that's really commendable that it's a big challenge that's being put in front of you guys to, kind of take these kind of patients and then heal them.
Understood. So, many of the times, it is like the first line of treatment. Obviously, I will go if I am not a doctor, what I will do is I will first go to my family physician. He'll send me to somebody else. He'll send me to a specialist. The specialist will be, sent to a super specialist or something like that. But you sometimes get the results, and most often you get the results, but sometimes it might happen that you don't get the results, and sometimes what happens is the disease is, acts very superficially. So if the symptoms are there, they act very, they are treated very superficially by certain medicines and everything, so they are relieved, but the disease is not gone because the disease is actually very deep rooted. So for the removal of the disease, for the removing the deep rootedness of the disease is where homeopathy acts.
That's amazing. That's a lovely insight about homeopathy. I also wanted one more thing, since you studied abroad. Is homeopathy practiced in abroad as well?
Yes, it is practiced. I have been to Switzerland and I have seen people practicing and taking homeopathy in a very different way, not like homeopathy which is practiced in India. Actually, India is the motherland. I would say that it was originated in Germany, but it was nurtured in India. So it is like Shri Krishna ने कहीं और जन्म लिया था, लेकिन nurture कहीं किसी ने और ने किया. हम nurture कर रहे हैं वो homeopathy को. And abroad में it is very very widely practiced. Not very not very recognized, but it is widely practiced.
Okay. So what is the base of homeopathy medicine?
So base of homeopathy medicine is like we believe into a principle called as similia similibus curantur. we believe that what causes the disease cures the disease. Like if you have a symptom, like if you have a disease like malaria, if you have a disease like a certain symptom like headache, okay, so it differs from the individual person. Like Fatima ji would have a different kind of a headache, I would have a different kind of a headache, or somebody, as per the individualization it changes. You might have a different modality, something might.
That is why whenever you go to a homeopathic doctor, he will always ask about your emotions, and what are your emotions, what are you feeling, are you stressed? I've always seen, when I go to an allopathic doctor, I have never had that kind of an experience. Those doctors will never ask you that how are you feeling. They just ask you kya ho raha hai, symptoms kya hai, and then the medicine is being given. But
exactly.
In homeopathy, it's a different process. So now I can relate what you're trying to tell me.
Exactly. So when you go to a modern medicine doctor, he would try to understand your symptoms, and based on that, on the investigation and everything, he would come to a particular diagnosis. And based on the diagnosis, he would give you a certain kind of medications and everything. But in homeopathy, our part does not end onto the diagnosis. Understanding after the diagnosis, we have to understand the person. So it's like a tailor-made thing. You wear a ready-made clothes, that is a different fitting. Once you wear a individual, you have in homeopathy, you have a tailor-made approach to it, suits your body. And to understand that, just like how your tailor measures your body in differently, and it suits you, it must suit you. That is why we try and understand how in homeopathy we try to understand the modalities. We try to understand how often do you eat, what do you crave, what do you dislike, what do you desire, how often do you sleep, even the dreams, the stool, the color of the stool, the urine, and coming to the mental aspect, because every individual is a different person. Even if you are a twin, you have a different kind of a mindset.
I can relate with that.
Yeah, and based on that, what happens is, on the mental symptoms, we try and individualize the medicine. If it happens like there are 10 people suffering from fever or suffering from certain disease, okay, based on that, everybody has a different modality, everybody has a different mindset towards it. Based on that, we give the medicine.
That's really interesting. Tailor-made medicine. That's amazing. That's really nice.
And
it's interesting. A new concept to understand in depth about homeopathy, that how it is impacting and healing people. So today's topic was actually about healing, about homeopathy, where we've understood little things from Dr. Prajot, that how is he practicing this medicine and impacting and empowering people. Now there's one question I want to ask you, Dr. Prajot. Since you've been practicing homeopathy, where have you seen proven results? Very effectively, which like you've seen that there are quick results, and people are happy with that practice of yours.
I would not say it is just like quick results. You get it in acutes, in whatever acute disease you have, like a fever or a diarrhea or something like that. I specialize into pediatrics.
Wow.
I have also learned about cancer. If I am not able to heal the particular symptoms, okay, in pediatric, if the patient might, the parents they come up with all the hype and everything. Okay, हमारे बच्चे को ऐसा हो रहा है, you do something. Based on the symptoms, I give the medicine, and based on that, and the patient gets better. So I have good results with the pediatric patients.
Wow, that's
great. And also in hyperallergy, because they have good amount of allergies. The bachus are, they are all, they have a tendency to get cold and cough often. There is pediatric colics that happen, that पेट में क्रैम्प आवे छे and everything. There is pediatric diarrhea that happens. That is very devastating thing, because the patient is very scared. The parents are very scared. Also, it is also an answer for those people who say that homeopathy is a placebo. If it is a placebo, how is it acting on a two-year child, or a 1-year child, or even a 2-month child? If it is a placebo, how it is treating that patients, and how are we? And if somebody is still questioning, you can come down to my clinic and you can challenge anytime. That is the thing.
This is an eye-opening session today, guys. Really eye-opening. When I was visiting your Instagram page, I've seen there are certain results that you put, somebody's not having some hair loss and you're getting that follicle back of your hair. That is extremely interesting. I think now, these days, we are so stressed. Because of our stress, everything is getting so disturbed in our body that we're not able to function properly. Our hair, there's a hair fall, dandruff. We have some skin issues. So that was very interesting. I would like to know about that. What are you working on that? What is that?
So to correct you, that it is not the hair follicle that has been coming back. Okay. So that is the thing. We don't I don't claim that I will treat everything and everything. That is not the thing. But the thing is that I have good results with hair and with skin. And particularly alopecia. I have read a meme with a very recent time कि stress की वजह से बाल जा रहे हैं और बाल जा रहे हैं इसकी वजह से stress हो रहा है. So it's like a vicious cycle. तो मेरे लिए बाल जाना important नहीं है. I will try and understand what is the stress. तो स्ट्रेस अगर मैंने कवर कर लिया ना, तो मेरे को अगर समझेगा कि इसकी इसकी ये चीज की वजह से स्ट्रेस हो रहा है, सो आई वुड फोकस दैट ऑन दैट स्ट्रेस. बेस्ड ऑन दैट स्ट्रेस की वजह से उसके बॉडी में क्या रिस्पॉन्स आ रहा है, हाउ इज ही चेंजिंग हिज रिस्पॉन्स, व्हाट इज बिन बॉडी इज, why is he shedding his hair, वो समझना मेरे लिए बहुत जरूरी है. And based on that, that is the deep rooted disease, that is why we understand what is the emotions, why it is emotions and other things.
It's all related.
Yeah. So I can give a topical solution and everything, तो ऊपर से तो आ जाएगा, लेकिन उसका मेन प्रॉब्लम is stress. तो स्ट्रेस अगर क्योर हुआ ना, तो बाकी सारी चीजें भी ये हो जाएगी.
Oh, that's a lovely session. Thank you so much, Dr. Prajot. It was a lovely session. We learned so much from you. And guys, if you wish to connect with Dr. Prajot, I'll be putting his link down. You can connect with him. Shall we share some bonuses with people?
Yeah, please.
Dr. Prajot, what is the bonus you'd like to give them?
Yeah, so if you are consulting for the first time, I will give like a 25% discount if they mention bond and boundaries.
Guys, this is the bonus we are talking about.
Yeah, so 25% discount on the first consultation, that is with the medicine as well. And
Wow.
You can get 25% off if you mention bond and boundaries, and also follow their Instagram page.
Thank you so much.
You can even follow my page on Instagram. It is called as Cherish Homeopathy Clinic.
Thank you so much, Dr. Prajot, for coming on this open talk and enlightening, giving us a session that is so insightful and enlightful, that people are understanding that why homeopathy is a good medicine to choose on, and they should practice it because it has no side effects, as well as you mentioned, and it's something good for children, since you're a pediatric doctor. So wish you all the very best in this journey of practicing and healing people.
Thank you so much. Thank you so much for having me, Fatima ji.
My pleasure.
And do follow their page. Thank you so much.
Thank you.